My name is Jacob Gonzalez, and I work for the nonprofit agency Search and Care. We're located in Manhattan on East 94th Street between 2nd and 3rd Avenue. This is going to be a four-part series. We have today Module 1. We're going to start with the basics because we want to make sure that each module is digestible and easy to understand because there's a lot involved here. It may not seem like a lot at first, but there actually is a lot of features on MyChart or telehealth in general that you can utilize. But before we do that, I'm just going to introduce you a little bit more about our agency, who is Search and Care. We are a 50-plus-year-old nonprofit in Manhattan, and we are dedicated to helping older adults age 60 plus in the Upper East Side, East Harlem, and Upper West Side to help folks live independently in their local communities. And we do this through our free case management, our socialization and educational groups, and our programming. One of those programs that I coordinate is called Silver Circles. We also provide one-on-one assistance for clients, but you must be 60 and over to be eligible. The way our program works is that we provide, like I said, one-on-one assistance. We can match you with a volunteer. We could actually do home visits. We can do an office visit. Once again, we're located on East 94th Street between 2nd and 3rd Avenue. And you can have as many sessions as you need depending on our volunteers' availability. So again, all of our services are free. Like I mentioned, we do socialization groups. I am also the group's coordinator. We have groups at Search and Care, socialization groups. So if you are ever interested and looking for other places to interact with folks, this is the place. We are a technology assistance program for helping one-on-one and group workshops. The reason why we really focus on those one-on-one sessions, especially for presentations like today, there may be some questions that folks may not want to ask because they feel as if they may hold the group back or they may feel embarrassed about asking. And having that one-on-one experience with a volunteer really helps to open up and ask and be more curious about technology. If you need any help on that, we understand technology is like learning a second language, so we're more than happy to take those baby steps along with you. We have a collaboration with Metropolitan Hospital. It actually started back in March 2024. We collaborated with the hospital to teach the geriatric patients how to utilize telehealth or MyChart, because we are currently tabling at the hospital and we're noticing people are going to the hospital for about 5 minutes to 10 minutes at a clinic and then they leave. We're noticing people, especially at the geriatric clinic, bringing along a home aide. There's a whole lot of coordination that's involved with a hospital visit. And so we really want to show folks the benefits of telehealth so that you don't have to make those visits to the hospital or the clinic if you just want to set up an appointment, if you just want to check your test results or things of that nature. So we are excited to teach you how to utilize telehealth. So what is telehealth? You've probably heard about this ever since COVID started because technology launched on the top of everyone's priority list and a lot of people were left behind. And so we're helping those folks with understanding telehealth. It's something that allows you to be with your healthcare provider without an in-person visit. This is done primarily online with internet access on your computer, tablet, or smartphone. If you look to the right of the screen, there's a couple of locations listed here, and they all have MyChart. NYC Health and Hospitals, NYU Langone, Advantage Care, they all have MyChart. There's multiple locations or facilities that utilize MyChart, and there may also be other places that have a private medical portal or something along those lines. You've probably heard about it, especially if you've gone to the doctor for the first time and they give you a paper like, oh, if you want to check your results or anything of that nature, go to this portal, go online, register, things like that. So what we're talking about today specifically is going to be about MyChart. And since we have a collaboration with Metropolitan Hospital, a lot of the screenshots that you'll be seeing today or the examples are from Metropolitan Hospital or NYC Health and Hospitals, but it still applies to any other MyChart website that you go on. There's going to be a lot of similarities here, especially the sign-up process, which we're going to talk about today. Before we get into the actual sign-up process, I just want to mention some of the benefits of utilizing MyChart, where you're able to personalize and secure online access to your medical records. It enables you to manage and receive information about your health. I think the biggest features here are being able to schedule and check in for a medical appointment, meet with a provider over the phone or a phone call, view details on your past appointments or hospital stays, view your health information, including medications, allergies, test results, etc., and request prescription refills. And also, I think a big feature here that folks don't realize that they can utilize is you can actually link all of your MyChart accounts together. So I'm going to go back real quick. So let's say you go to Mount Sinai Health and Hospitals and NYU Langone. You're able to actually combine all of those accounts together. So you can see all of your appointments at those medical facilities, all your results, all in one space. You don't have to sign in separately depending on which facility you're at or things of that nature. That's a really good benefit. So how do we access MyChart? There's actually two ways you can do this. The option we're going to be discussing is whenever you go to a doctor's office for the first time, they usually provide you with a paper, an email, or a text message with an activation code. That activation code is going to be the set of numbers and letters that you will need to sign up for MyChart. If you don't have a code, that is totally fine. There's a way to retrieve this, and you can see on the bottom here, this is the hotline for NYC Health and Hospitals MyChart support 24/7. We've done this ourselves for our own clients. So let's say you've had a MyChart account and you haven't used it in such a long time and you need to reset some things, you can give them a call. They will help you out. If you've never received an activation code to begin with and you need to start the sign up process with MyChart, they are more than happy to help you out. I just want to throw that out there. So if you wanted to get started today, boom, that's the number right there. So activating MyChart with an email. There's two ways actually that you can activate MyChart. That's email or a text message. Like I mentioned, after your first medical appointment, your provider should send you an email or text with a link to MyChart. As you see here on this screenshot, this person received a message or an email from NYC Health and Hospitals. The subject line is "Welcome to MyChart at NYC Health and Hospitals." It's saying, "Hello, Michelle. Your recent visit makes you eligible to secure access to your medical records online." In that email, you're going to see an activation code along with a link to click on. I'll show you in the next photo. It's going to be a little bit easier to see, but you're going to get those two things, an activation code and a link to sign up. This is actually the text message version right here. So if you see on the right, it's a little bit different compared to the email. I'm going to go back real quick. The email, there's a subject line, there's an actual name of the hospital that's being sent to the recipient. But for this one, as you see on the top of this text message, it's actually saying 622-622. And you may have seen that a couple of times whenever you're trying to sign up with a program or anything of that nature where they need to verify that you're the real person. You may get a message with just these numbers and not an actual name. So I don't want you to be afraid of that. So for this text message, it's going to be the same exact language that you find in the email. Like on the bottom here, it says to access MyChart, go to epicmychart.nychhc. There's a whole list of things in that link, but it's usually going to be blue and you're able to tap on it or click on it. That link is going to take you to a sign-in page. And as you see on the bottom of this link, there is an access code or an activation code. It's just a list of numbers here. So it's like 5BP4N P9TKK. That's going to be the access code for this person to sign up with MyChart. Now, we need to verify our identity. They wouldn't just give anyone a patient's information without verifying. This is the time where they need to make sure that you are you, not a stranger pretending to be you. The screenshot here on the right, this is going to be the sign up page. So whenever you get that email or text message, you're going to land on this page where it says to please identify yourself. And all you'll need for this, it's actually pretty simple. You'll just need your activation code that you were provided in that email or text, your zip code, and your date of birth. That information is plenty enough to verify that you're the patient. It's similar to how when you're going to the pharmacy, they ask for your date of birth just to make sure that you're you, just to verify that you're the person that we're going to be prescribing those medications to or providing them to. And so that's what this is. This is just to verify that you are you. There is nothing nefarious about this. I just want to clear the air about that. Once again, people get a little bit weird. Like, why do they want to know my zip code? Why do they know my date of birth? It's just to verify that you are you. This part here can be a bit tricky. Once you've input your activation code, your zip code, and date of birth, the next step is two-step verification. I'll give you an example of what that looks like. It's essentially whenever you're trying to log into a website, or let's say you're trying to go onto Facebook on your account, and you're logging in, instead of on your computer, you're logging in on your phone. And it's the first time you're ever logging in on your phone on Facebook, and so they're like, wait a minute, are you really Catherine? I'm not sure. So let's verify that you're the person that you say you are. And so they send you you either in an email or a text message an activation code. So you have to go into an email, get that activation code, provide it to Facebook, and then you can log in. That's called two-step verification because the first step is logging in. The second step is getting that activation code and providing it to Facebook in that example. For MyChart, it's very similar. We do these in person and sometimes we help folks right after. That's why we had this little section here to let folks know that for this presentation, we usually tell folks to not have two-step verification just because there's a lot of steps involved with this. There is a pro to having it on. The pro is that there's better security. Even if someone were to get your password, they would still need to get the activation code from your phone or your email. So that's another step to prevent anyone from stealing your information because God forbid you wrote down your password somewhere and someone saw that and they try to steal your information, but they don't have your phone. So they're not able to input that activation code. But we know with our own clients at Search and Care that anytime that there is two-step verification, it can be a bit frustrating because imagine this, every single time that you want to log into MyChart, you're going to have to go into your email, get that code, and then put it into MyChart so you can verify that you're yourself. And that is every single time that you log in. You logged in and then you logged out for the day, but then later in the day, maybe like 5 hours later, you want to log back in, you're going to have to do it again. We ask folks to usually turn off two-step verification if you want to avoid that frustration, but if you want the security, we suggest turning it on. There's going to be that frustration once again, but it's up to you. But we prefer not to have it on just to avoid frustration with folks. Once again, every time you sign in, you will need to activate that code. A little example of what it looks like. The activation code is on the left, and the section on the right here is where after you logged into MyChart, it's going to give you a page asking you for that code. And it says here on the right side, we sent a security code to your account, to your email address. Now on the left, if you see here, this is from my email. It says, hello, Jacob. To verify your MyChart login, use the following code, 655877. And it says this code will expire as well. So there's a time limit with this as well. So that's another aspect. So time is of the essence to actually get into that email, to get that code, and then attach it to this section here on the right. But the good news is there's another thing you can do where if you see right under the code, you can check off where it says, remember this device for 365 days, which is a year. This is only if you know for sure you are the only one using that device. This means if you have two-step verification on, and if you have a computer that you normally use, if you check this off, you will no longer see that verification message. But let's say you had to leave the home for a bit and you had to use your phone. That's when it's going to ask you for a verification because it's a new device that's being signed on, and MyCharts, they're very suspicious of that. They're like, why is this person signing in with a new device? Let's make sure that this person is who they say they are. Once again, you're going to have to go through this. Next is creating a username and password. Your username should be something that is easy to remember. Your username is what's going to be displayed on your MyChart page, and I'll show you that in a moment. Like for myself, I do something that's very simple. My first name, last initial, and a number. So it's usually like Jacob G 5000 because it's easy to remember and it mentions who I am really in one little fell swoop. That should be easy to remember, but on the opposite end, your password should not be so easy to remember. We want it to be easy for you to remember, but we don't want it to be easy for someone else to possibly guess that. We wouldn't want to do, let's say you have a pet, you wouldn't want to do your password marbles 123 because that 123, it's pretty easy to guess. And sometimes you can guess that, oh, Miss Smith loves that dog Marbles. So I'm just going to guess that it could be Marbles. Let's do 123. And then boom, they're in. But thankfully, if you have two-step verification, that's not the case. But still, you want to make it hard for folks to guess. So that means you can include a combination of a couple of things because passwords are usually case sensitive. And all that means is that if you have an uppercase letter in your password, you're going to have to retype it and make sure that letter is also uppercase. So it's usually a good idea to combine numbers and letters in your passwords and also include lower and uppercase letters just to throw people off. After you've created your username and password, MyChart wants to ask if you would like to receive any notifications. Notifications, that can mean whenever you have your phone out and you see a little display that, oh, you have an appointment available or an appointment is coming up in 2 days. That's what happens whenever you enable that on MyChart. It lets you know important information at a moment's notice. So that means if you took a blood test a couple of days ago and the results are now available, you will get a notification about that. If you're trying to message your doctor and they responded to you, you will get a notification regarding that. With the screen here on the right, there's two methods to receiving notifications. You can either receive an email notification or a text message notification. On the top here, we can see that this person has enabled notifications by clicking on yes, which is orange. They would have to input their email address so they know which email to send those notifications to. Right below that, it's asking you if you would like to enable text messages. For this example, the person requested no, because if they put yes, that means anytime they get a blood test result or anything like that, they're going to get an email and a text message about it. And I know a lot of folks prefer that, and that's totally up to you. If you don't want any notifications, you can put no for both of them. A little note about this, it's on the bottom here, right below where it says enable text message notifications, it says to input your mobile number. For this example, the person signed up through MyChart with a text message. So MyChart sent the patient a text message and they already know your phone number. They already have that input here. The opposite would be the case if you answered an email and you activated it that way. This email would already be input and it would be shaded out. You couldn't change it. Don't worry if one of these are shaded out. That just means they already had that information. Next, this section here is just agreeing to the terms of service. I do suggest folks read this. It's pretty lengthy, but it's always good to know the rules and guidelines that explain how you can use MyChart and how MyChart themselves protect your privacy and information. In order to proceed, you do need to hit accept. Just make sure to at least browse through it, just to double check what type of information is being shared or can't be shared through MyChart. After that, you're now on MyChart. Congrats, woo! So right here, this is gonna be the home page. There's gonna be 4 main features on this home page that are easy to access, and that is scheduling and viewing your appointments, viewing messages from your doctor, viewing test results, and checking your prescriptions. And we're gonna really break this down in the next section because we wanna make this as digestible as possible. We wanna make this a very basic understanding, and then moving forward, we get into more details and whatnot. The next section here, we're just gonna show you some examples of these features. But before that, I just wanna mention here on the homepage, if you look on the top right here, it says Michelle. And so that, once again, is your username. If you have Jacob G5000 as your username, it would be up on the top right-hand side. And that's how MyChart will identify you. It's on the top left, it should say visits, messages, test results, and medications. Those are gonna be super important because these are the main features of MyChart. The first example, this is a very important aspect of MyChart. So this is examples of viewing your upcoming appointment visits. For this example, we're looking at future visits that are upcoming. There's one example here. I'm gonna look at where it says May 1st. It lets you know what type of visit this is. So on May 1st, this is going to be a new patient visit, and it lets you know the doctor's name as Dr. Singh, and it has the location of where your appointment will be taking place. For this example, it's going to be at Metropolitan. It's going to be a surgery location, and it tells you the arrival time and when the appointment's going to start. It gives you all that information, which is great. It'll remind you whenever an appointment is coming up. If you have those notifications enabled, they will let you know whenever an appointment's available and when to check in. This is even more important. So these are your past appointments. What this is great for, whenever you go to the doctor and there's a lot of conversation going on, sometimes it can go in through one ear and out the other. And it's not anyone's fault. It's just sometimes you're just getting fed a lot of information. It's hard to retain all of that. But the great news is that you can actually look at those notes that the doctor created for you on your past visits. If you see here, this looks very similar to what we saw in the previous slide, but there's 2 additional buttons here that are very important. If you look here, it says view after visit summary. And what that is the basic information, like when you're going to a doctor's appointment and the nurse is checking your weight, your blood pressure, all of that, that's usually going to be in that after visit summary. Or let's say you did the visit and it turns out that you needed to get prescribed some medication. That's what would be in that after visit summary. In the view notes section though, right above that, that's even more important because if you ever spoken with your doctor and as you're talking with them, they're just typing away on the computer as you're speaking with them, that is where these notes are going to be located. So this is a great opportunity to just look back, especially if, once again, it was difficult to understand what the doctor was saying, or if it's easier to read it and get a visual of what you're looking at, or even if if you need to look up information that the doctor mentioned, you can just copy and paste that info into Google Chrome or whatever. Just throwing that out there. This is a great way of viewing your past appointments. And by the way, we've had clients say to us that they've had records show up to like 7 years. So if you're going to a facility that has MyChart, those past visits should be available to you. Now, we have another important situation right here. This is messaging your medical provider. I can't stress the importance of this, and I'll give you an example of why in a moment. But for this example, this person actually at Mount Sinai. So if you see on the top left, it's Mount Sinai Health System. This nurse practitioner, Amanda, is a part of that system. So they're not with Metropolitan. And remember, you can look at multiple facilities, all in one location on MyChart. You're able to easily access your healthcare team via messages. So for this example, the patient has a pacemaker. He's just looking for how long is the battery life on it. Remember, anytime you're doing a message to your doctor on MyChart, these are for non-emergency medical questions. So this example here is a perfect reason for messaging your doctor because it's not urgent. It's just, I want to know this information just for my own well-being. What the nurse practitioner sent was, hello, your pacemaker home monitoring report is stable. The device is working normally, and there are 9 years remaining on the battery. That's great information. Once again, it wasn't something that needed to be done. It wasn't an urgent situation. It wasn't a question of, hey, my pacemaker isn't working properly. What should I do? At that point, you should be calling either 911 or you should be going to the emergency room or some place to get seen. Even on the bottom here, it actually states, please allow up to 3 business days for a reply. You may not receive a response right away, depending on your doctor. Because in this example, the nurse practitioner sent this at 6:15. So we don't know when the person actually sent this message to them, but it does take at least 3 days for folks to respond. This is an example of checking your medications. This is a great example of seeing that there's 2 facilities available to this patient here. So if you see on the top left, it says NYC Health and Hospitals, and to the right of that, it says Mount Sinai Health System. So what that means is if you were to click on NYC Health and Hospitals, you'll see all of your current medications regarding that facility. For this example, this patient is receiving vitamin C, 1,000 milligram tablets. Right below that, it actually states the instructions. It's very simple instructions, is to take 1,000 milligrams by mouth daily. But usually if there's more involved prescriptions here, there will be more detailed notes. Let's say there's a medication that you need to take after eating. Those instructions will be included on this page. If you're like, oh, I forgot what the doctor said about that medication, if I should eat before or after, you can always refer back to your medications, or you can message your doctor as well. Once again, if you were to click on Mount Sinai, you would then see the medications prescribed through that facility. Okay. We just gave you a little teaser of MyChart and the basics and how to sign up. Next, we'll be getting into more details about scheduling the appointments, checking your medications, messaging your doctor, all those tidbits we're going to be going over. Our information is right on this screen. After one of our presentations regarding messaging your doctor, I heard from one of our clients mentioning how learning about that literally saved his life. There was a moment, I think he said 3 days after that presentation, his doctor was trying to get in touch with him. And mind you, this patient has some heart issues. And so the doctor was trying to get in touch with him over the phone. I don't blame him. Whenever he sees an unknown number, not going to pick it up, right?
Yeah.
And so the doctor was trying to call just to get some readings on blood pressure and things like that. The doctor ended up messaging the client on MyChart. And thankfully, he's like, oh, I'm just curious to work on MyChart now. And he noticed that notification
Wow.
that the doctor was messaging him. The doctor was just asking like, hey, just wanted to see if you can give me a call so you could provide me your blood pressure readings. And after doing so, the doctor was like, ooh, this doesn't look right. Can you please come to the clinic? And so the patient actually went over there, and during the appointment itself, he ended up getting a heart attack. He lives alone too. So who knows what could have happened if he didn't even noticed that someone was trying to call him, or he ignored it. And thankfully, due to MyChart, he was able to see that notification that someone was trying to get in touch with him so that he could follow up. So just want to mention like how important that really is.
That's such a good tool. I think a lot of people now, you screen your calls, you don't necessarily see everything that's coming because you're worried about picking up something that's scammed. I think that this can be so helpful if you're getting texts or something and you get used to seeing MyChart come up, then you know that you can rely on that, the way that looks and what number it's coming from, that sort of thing. What else can you say about the security that goes with MyChart for people who might be a little bit worried about having their medical information available to them online?
So all this information is only shared with your healthcare team. There's an actual feature on MyChart for end of life planning. So there's actually a section where There's your wishes for your family that your healthcare team will not have access to, and it will mention that. So there's a couple of features on MyChart where it states this is for your own notes. So like for medications, you can actually put some notes there. So let's say I only want to take this once a week, and that's like a note for yourself. You can type that in,
Sure.
and only you can see that, no one else.
Gotcha.
So there's other aspects or features on MyChart. It will let you know who can or can't see this. There is a way to share that information with a patient, or you can have like healthcare proxies assigned so that they're able to
They
access
can
your
see it.
MyChart account that way, or see
Mhm.
certain bits of information, I should say. I just want to emphasize there's one little issue that even the folks at MyChart are frustrated with. For any notes the doctor creates for you, it cannot be translated. So MyChart itself, there's ways to change the language for the whole system, but for specific notes that a doctor would create for you, it wouldn't automatically translate that. So I just want to emphasize that for anyone. I'm going back to the slide with the example of checking medications. If you look on the top right-hand side, there's a little printer icon, and that's where you would be able to print the necessary information. And it's usually there for medications, test results, things of that nature. There should be some printable areas for sure. And there's specific icons for that, depending on which part of MyChart you're looking at.